Selamat datang ke ASM Podcast yang dibawakan khas oleh Akademi Sains Malaysia. Siri podcast ini merupakan platform perkongsian topik-topik berkaitan sains, teknologi, inovasi dan ekonomi STIE secara santai dan mudah difahami. Setiap episod akan menampilkan jaringan pakar ASM yang akan berkongsi pengalaman dan pendapat mereka tentang STIE seiring dengan etos ASM. Budayakan sains, raikan teknologi, cetuskan inovasi.
Good day, everyone. I'm Mazlan Othman of the Academy of Sciences Malaysia, and welcome to this second episode of our ASEAN Forecast podcast. Today's podcast is dedicated to World Environmental Health Day, an annual event observed on September 26, which was initiated by the International Federation of Environmental Health. Now, first, some background to those who are listening in to the podcast for the first time. In 2019, the ASEAN Foresight Alliance, and short form is AFA, was founded with the aim of fostering connections between ASEAN and worldwide foresight endeavors. So, under the umbrella of AFA, the Academy of Sciences Malaysia is actively working on the creation of an ASEAN Science, Technology and Innovation, in other words, STI Ecosystem Foresight for 2035 report. This report will delve into global megatrends and their potential implications for science, technology and innovation within the ASEAN region. The core concept here is the need for ASEAN nations to collaborate closely in addressing these trends collectively for the mutual benefit of the entire community. In alignment with this objective, the Academy of Sciences Malaysia is organizing a series of podcasts, which you are seeing the second one today. And we also organize webinars to delve into the intricacies of establishing and managing the ASEAN STI ecosystem. And so today we are extremely privileged to have a very special guest, Dr. Renzo Quinto. Now, I have to say I worked with Renzo before in another conference. He is one of the world's pioneers in the new field of planetary health. He holds a Doctor of Public Health degree from Harvard University and a Doctor of Medicine degree from the University of the Philippines, Manila. Dr. Renzo is the Inaugural Director of the Planetary and Global Health Program at the St. Luke's Medical Center College of Medicine in the Philippines. He is a member of the National Panel of Technical Experts for the Climate Change Commission of the Philippines. Now, he has a very wide consultancy background, including the WHO and the World Bank. He has authored over 200 reports and articles in scientific journals, books, and popular media, and directed and produced short films. We must talk about this, Renzo, these short films that communicate the message of planetary healing to the world. Exciting idea. And so, renowned for his contributions, he has lectured in nearly 60 countries and received accolades such as inclusion in the Tatler magazine Gen T list. I am familiar with this one. And the Outstanding Young Men and Women of the Philippines Award in this year. When was that award, Renzo? This Outstanding Young Men and Women of the Philippines?
In 2022. Just last
2022, year. Just last year, you see. And in this year, the St. Luke's Planetary and Global Health Program, which he founded, was awarded the inaugural, I can't mention this, but it is CUGH Belgian Planetary Health Innovation Award by the Consortium of Universities for Global Health. And maybe you might like to talk about that later. Now, what most people don't know is that Renzo has been in Malaysia for 1.5 years, where he was Chief Planetary Scientist at the Sunway Center for Planetary Health. So we have a good friend here and of course, a renowned scientist. So, Renzo, thank you for making the time to be with us virtually to discuss this project. I wish I had approached you a little earlier when you were still in Malaysia, huh? Then we could have both been discussing face to face. So, welcome, Renzo.
Well, thank you so much, Professor Maslan, and of course to the Academy Science Malaysia for this wonderful opportunity. Indeed, we are all friends here. Malaysia, yes. Philippines, we're all one ASEAN. So I'm really, really excited about this conversation and the initiative. And I'm sure I'll be visiting you in Malaysia sooner rather than later.
Oh, yes. Please, soon, Renzo, soon. So let's start with, discussing the world trends. And so what do you think, Renzo, are the most pressing environmental health issues globally?
Wow. I mean, right now we live in this day and age when our health, the health of people, is basically being shaped by so many things happening around us in the environment. There was actually a report from the World Health Organization that was published a few years back, saying that around 25% of the world's illnesses, diseases, are actually driven by changes in the environment. And actually, I think that is still an underestimate because there are many other things around us that are hard to quantify. And for sure, there are many other health issues that are not captured in that number. Nonetheless, 25% is very big. And moving forward, we can anticipate more diseases to be influenced by the changing environment. And so what are these changes in the environment that are already affecting our health, not only in ASEAN, not only in Southeast Asia, but across the world? Climate change, of course, is perhaps one of the, if not the most important existential threat to humanity. And, unfortunately, when it comes to the climate crisis, the clock is ticking very fast. There was actually a study that was published, I think, just a few weeks ago, saying that we are at the, we're about to breach the 1.5 degrees Celsius limit, not in 2030, but 3 years in advance, in 2027.
In 2027, yeah.
And we know that climate change is going to affect the health of people in many different ways, not only our physical health, but also our mental health as well. And, when it comes to the physical health impacts of climate change, you have heat-related illnesses. I'm sure in Malaysia, but also in the Philippines and in many other parts of our region, people are now starting to complain of hotter summers and the temperature is continuing to increase. And, our bodies are not built for, much hotter weathers. And so that is going to be a major public health threat moving forward. But it's also not just the hot events, but also the wet and the the hydrometeorological events related to climate change that are causing a lot of health problems, from typhoons. The Philippines just finished a typhoon recently, and more are yet to come, unfortunately. And flooding, and in Malaysia, for example, I remember, I think it was 2021 when, Kuala Lumpur and surrounding, cities and towns have faced unprecedented flooding, never before seen in the history of your country. And this is also happening in many other parts of our region and in the world. So climate change is certainly, a pressing environmental health issue, but also, for example, pollution to the air, water, and land. Air pollution, Asia and ASEAN in particular, is home to some of the biggest megacities. And imagine our children today are inhaling pollution, air filled with toxic chemicals, particulate matter, which not only harm our lungs, but also clog our arteries, our blood vessels, which can then lead to, chronic disease and, early mortality in the future during adulthood. but also water pollution, plastic pollution, for example. There was a recent report saying that, the coral triangle, which is, the seas between the Philippines, Malaysia, and the mainland Asia, which is home to some of the richest marine biodiversity, is also a hotspot for plastic pollution. And now, plastic is also not just found in the ocean, it's also found in our bloodstream. There was a Dutch study that was published, I think just last year, saying that now you can detect microplastic in the blood. So the pollution is in the planet, but also inside our bodies. So these are just some examples of pressing environmental health issues that we are facing that we must address.
There is an interest in vector-borne diseases. So what are some of these implications of these vector-borne diseases for public health?
So a while ago, I mentioned heat-related illnesses. I also mentioned, flooding, for example, which can lead to infectious diseases, etc. But you're right. Vector-borne diseases are also another important group of disease conditions that are sensitive to the climate, but also very endemic in a region. What are these vector-borne diseases? Dengue, malaria, Zika, chikungunya, name it, they're all present in Southeast Asia. Because, we have our rainforests, or our urban centers, which are a good breeding ground for all these mosquito-borne diseases. And unfortunately, these mosquitoes, they love climate change. they continue to spread more and to be transmitted more when the planet is warmer. And so certainly, these issues, these diseases are going to be very important. We need to address them, whether you are from rural Philippines or even the city-state of Singapore is also being affected by these tropical vector-borne diseases that are sensitive to the climate. And therefore, we need stronger public health response, not only domestically, but also between countries. And that's why I really like that we're talking about ASEAN, because we ASEAN countries should be working together to address vector-borne diseases and many others.
Right. And part of this is what we call the neglected diseases, right? And mainly a lot of it in the tropics. And I think we did discuss that during the conference 2 years ago. So having said that then, how do you think the ASEAN countries are preparing themselves?
Great question.
Well, your view, Renzo.
One way to answer it is to reflect on the pandemic that we just survived, right?
Okay.
And, because COVID-19 is also an infectious disease, and, it's also related indirectly to environmental change. Because, when we start destroying our forests, when we continue interacting with wildlife, there's a very high chance that these viruses will jump from animals to human beings. That is the start of COVID. And what happened? Many of our countries around the world, but even in our region, we were caught by surprise by this pandemic. We have some of the ingredients that are needed for pandemic response, but overall, we are caught unprepared. And so I hope that COVID-19, the pandemic, serves as a teaching moment for all of us in terms of how we can prepare for future infectious disease outbreaks, like mosquito-borne disease outbreaks that can be or that will be driven by climate change and other forms of global environmental change. So that's one answer. We're unprepared. But I think Southeast Asia is also a place where there's already a lot of things happening in terms of research, for example.
Okay.
Because, we're very familiar with dengue and malaria, and we need to do something about them. And so I'm just amazed actually by our universities in the Philippines, in Malaysia, in Thailand, in other neighboring countries that are doing research on vector-borne disease prevention and control that other regions in the world can actually also utilize and learn from. And I think what is also needed is a more regional approach to these diseases at the ASEAN level. And, there are already efforts happening in the ASEAN level, in Jakarta,
Yes.
among the ministers of health, but more needs to be done. And that requires also more resources, money.
Yes. I like that you brought up COVID-19 and the reaction of the region to it. Now, Renzo, my sense is that there was no coordinated ASEAN response to it, and that most of the time, maybe for good reason, we were mainly dependent on what was happening in the US and in the UK and places like that. But I didn't have a good sense that ASEAN, through whatever mechanism that we had, was actually trying to get on top of this. What do you think?
Well, and that's why I said we need more resources first to strengthen our existing ASEAN units or bodies responsible for public health. In Jakarta, the ASEAN headquarters, there's a very small group focused on health. And that group is responsible for coordinating public health efforts for a region of close to 700 million people. So, we need to expand and strengthen those existing bodies. But also, there's a need probably for new institutions. And, we can also learn from the experience of Africa. Before the pandemic, the African continent, through the African Union, which is the ASEAN of Africa, established the African Center for Disease Control, the Africa CDC, which is the counterpart of the US CDC or the Chinese CDC. And because of that institution, Africa was able to actually implement a lot of pandemic measures. There was a lot of cross-country learning. And maybe it's time for an ASEAN CDC, something along those lines.
Yeah. So, but again, my sense was whatever brought Africa together was the Ebola pandemic. They learned a lot from the Ebola pandemic, not only bringing the experts from overseas, but themselves keeping data and how to manage it very well. So I think with that Ebola experience, they managed the COVID-19 quite well.
But we also had our SARS experience in the early 2000s,
we had our SARS experience too,
as well as avian flu. So we could have actually learned much earlier.
Yeah. But did we, Renzo? We didn't.
We didn't on a grand scale. But I think there are pockets of good practice, among countries and even at subnational levels.
Yes.
And I guess what we need really is greater collaboration. For example, let's start with the universities. And, now I'm starting to think, our Malaysian universities, Philippine universities, Thai universities, Indonesian universities working together around environmental health, pandemic prevention and preparedness, etc. Maybe that's the beginning. We can start with the universities.
Yeah, and we mentioned that it needs investment, in these things. But to me, something which actually doesn't need big investment is the way we interact, the way we exchange experts, for instance. In Malaysia, even exchanges between researchers in different universities in Malaysia is not so easy, And we should do a lot more of this. We should allow mobility amongst the researchers. And I think one of the big things that should have to come out of the foresight that we are doing is that in the future, we have to ensure that there is greater mobility between our experts and our researchers. We shouldn't have to go through, big red tape, bureaucracy to let this happen. Anyway, so That's the environmental and public health aspect. Um, do you think, having seen what happened during COVID-19, that technology, now we're looking at whether technology can assist us in combating all these problems, that can contribute to improving environmental health in the region?
So, technology is another area where there can be a lot of collaboration, right?
Mm.
A lot of data sharing, a lot of knowledge and skills transfer. And Southeast Asia is actually a place where there's a lot of digital innovation that is
Mm-hmm.
happening. Let me use the Philippines as an example. I think in terms of Facebook penetration, it's more than 100%, meaning some people even have two Facebook accounts. And so
Well,
a lot of our people in our region are very digitally connected.
uh-huh.
But how can we take advantage of these digital technologies for information sharing and fighting misinformation
That's
about
very important.
pandemics, about
Yes.
climate change, right?
Mm, mm,
And also spreading good information on how to protect themselves from infectious disease, or how to crowdsource information about the environment. Oh, there's some pollution happening in one place, or there's an endangered species that was being captured, for example, by an illegal wildlife trader. How
mm,
can we
mm.
use such technologies to even democratize the collection of data so that our policymakers can make the right decisions? Because that's part of environmental risk monitoring. And then, of course, we need to make sure also that the technologies that we are producing and introducing to the community are not harming the planet and the people,
Yes, in the
are
first
not
place. Yeah.
polluting, low carbon. And I think this is another area for potential research. And again, it requires a truly transdisciplinary approach, bringing
Mm,
together the techies and the environmental experts, but also the social scientists, because digital technology is again shaping even the discourse that we have about climate change, about health, and we need to make sure that our population is basically the discourse is not contaminated with bad information.
well, this is the other thing that I wanted to bring up. I mean, during the COVID-19, on a day-to-day basis, you just could not tell who you could believe, even if it's coming from the CDC. I mean, anyone with a microphone and a camera behind his steering wheel, he's talking as if he knows everything about COVID-19. And then these are the things that flood WhatsApp, that floods Twitter. I mean, maybe not so much Twitter, but Facebook and Instagram. So maybe I'm putting you on the spot here by asking you, how do we overcome this in the future, Renzo? Any thoughts on that?
Well, at the individual level, we probably should all be in TikTok. And we should be, it's funny because my sister was also encouraging me, older brother, you should be in TikTok because the people should know about climate change, the people should
Yes,
know
yeah,
about
yeah.
pandemic. So I'm thinking about it,
Okay.
and maybe
Mm.
you'll be my first guest when I am
Now
in
I see
TikTok.
what you're driving at.
Right.
To combat all this misinformation, it's like people like you and perhaps even me putting out that information as well, huh,
And
Renzo?
that's just one solution. Because
Yeah.
number two, there has to be a structural solution or a
True.
policy
Mm.
solution.
Yes.
And I
Yeah.
think that we scientists, for example, here in ASEAN, should
Mm.
come together to call for stronger regulation
Mm.
of
Mm.
the digital space. We should
Mm.
hold the tech companies to account. We
Yeah.
should,
Yeah.
call for, safeguards. For example, maybe we should even be not allowing our children to be in Facebook or social media up to a certain age, right?
No,
Because
no,
now there's
Renzo. That horse has left the stable. You're not going to pull that horse back. I mean, no, but you're not going to stop anybody from going to Facebook. I'm sorry, but yeah, but you're absolutely right. We have to what is that word? Regulate. I gather from all my readings that that's one of the biggest problem. And this issue of AI, because AI is also going to give us a problem later, when it comes to misinformation. You can't just pull the plug from AI, huh? It's impossible. As I said, that horse has left the stable. There's no way we can tame all that what is that word, chaos that's happening out there. But let's get back to track.
Sure.
and I am going to ask you, are there any emerging trends or developments in the technology field that you want to perhaps highlight that would be of interest for the environmental and public health?
Yeah, sure. Well, in a way, a while ago, I alluded to the potential of digital technology and democratizing digital technology when it comes to monitoring pollution, right, and other forms of environmental risks. But also, for example, and I guess it's in relation to that, early warning systems. People need to know and know in real time or even ahead of time if something is going to happen. Is it a typhoon? Is it flooding? Is it contamination of their drinking water? Or is it a heat wave? So on and so forth. And right now we're still, I guess, stuck in the 19th or 20th century when it comes to informing the public about these threats. And so this is another space where technology can play a vital role, again, in informing the public about environmental health risks. And then you already mentioned AI, and I guess we need to capitalize on it as well for research, right? Because sure, there will be a lot of data to be collected or are being already collected about people, about the environment, about animals, about the climate, about water. How do we make sense out of this you mentioned a while ago, chaos of data?
Yes,
right?
yeah.
And so we need to take advantage of these new methodologies so that we can make better decisions, and decisions that are quick and impactful as well.
Yeah, I like that early warning systems you mentioned, and for for a lot of the occasions, that we need to put that into the thinking process. Are there early warning systems that we can put in place, like a tsunami? We've talked about that for years and years, and maybe for diseases, we should have something like that too. Okay, so Renzo, I'd like to shift to the talk on policies and regulations. I know we started talking about this already, but do you think government policies and government regulations, well, maybe have they played a major role or good role, or can they now continue to play that kind of role?
Yeah, well, certainly. And I think the challenge now is because right now, as we speak, many countries are deliberating, creating new policies. For example, here in the Philippines, we are at the tail end of the development of the country's national adaptation plan for climate change. I understand Malaysia also has its national climate change action plan. Many other countries are doing the same. So I think policy-wise, there's already momentum that is, happening, running. We need to keep the momentum, but we also need to hold governments to account in terms of implementation, in terms of putting the money that is necessary so that the different actors from national to local levels can actually turn the policy into reality.
I know. to walk the talk,
Indeed.
we are so good at declaring, proclaiming, this is what we want to do, but not following it up with
Yep.
real implementation.
But
And I think that's a
it's an important first step.
absolutely
Yeah.
right, right. Okay,
To
yeah,
declare the aspirations and to enumerate the instructions for the rest of
absolutely.
society.
I agree with that. But at the Academy of Sciences Malaysia, we are very fast learning that if we're going to advise government on anything, we cannot stop at just saying what the rules, what the policies and regulations should be. We must take an active part in that action plan, that the strategic thinking and the action plan that must come afterwards. And not only that, Renzo, I think we need to be active in the monitoring of that policy and regulation. So it's not just making policy, but of course making the investment, and also for us scientists, push the government in terms of the implementation. As I said, we have to go beyond just declaring. So now, Renzo, I have my I'm looking forward to this, asking you this question, talking about policies and regulations and whatnot. I know that you have this, as I said, I first was attracted to what you were doing because of your concept of decolonization. Could you say something about that in whatever context? In this case, it's about environmental and public health, but also in climate change. Where do you think this decolonization, we should be looking at decolonization?
Yep,
And
I
what is it?
agree.
First of all, tell us what it is and and why we should be listening to you about this.
Sure, and I agree. It's a very big word, and usually it's the academics who love talking about decolonizing, right? And as we speak now, every sector, every space has been using this term. Decolonizing education,
Yes.
decolonizing even our food, our diets, right? And the
Mm-hmm.
colonization has a few definitions and interpretations. Of
Okay.
course, the core term there is colony, you know,
Yes.
and colonization is
Mm.
that process wherein one country, which is usually more powerful, uh, begins to take control over another, right? And
Yes.
our countries are products of colonization. The
Of
Philippines
course. Yeah. And
was under
Malaysia.
Spain for 3 centuries, and the United States for a quarter of a century. Malaysia, of course, used to be part of the British Empire. Now we are free countries. But of course, you may also argue or ask the question, are we totally free or decolonized, right? Or are we still experiencing the colonial legacies, the colonial baggages
Mm.
that were
Mm.
left by our colonizers? And that is actually what I think decolonization was trying to explore and unpack, right? How
Yes.
can we liberate ourselves from these colonial ways of thinking, these colonial structures that were a product of that historical
Mm.
colonization experience? But also, there are other, there's another term, neo-colonization, new
Mm-hmm.
forms of
New
colonization that
forms.
is happening,
Yes.
right?
Yeah.
The colonization of, for example, the corporate sector, the
Yes. Yeah.
colonization of, new trends and ideas and new ways of thinking. So that's also kind of part of that, the colonization narrative. How can we make sure that we fight against,
Mm. Mm.
these ideologies that are dominant and that may be, creating or even perpetuating the injustices
Yes.
that are present
Yes.
in society.
Mm.
So, in my work, I've always been talking, describing about how to decolonize, for example, health, right? Are thinking about health. Thinking about health not only in a purely Western and biomedical way, because our health is shaped by our societies, our cultures. We have so much to learn also from indigenous health systems,
Absolutely.
which are present in Southeast Asia.
Yes.
And then how do we decolonize science, knowledge production, right? A while ago you were mentioning about mobility between Asian universities. We tend to only think about going to the north or to the west
Exactly. Yeah.
for
Yeah.
knowledge, right?
Yes.
But
Yeah.
but we can learn from each other as well within our region, right?
Absolutely. Yeah.
And within our countries.
Mm.
And even decolonizing, you mentioned climate change and
Yes.
climate action, climate
Mm.
policy. And there are many different aspects of the climate discourse that need to be decolonized. The way we conduct research on climate change. I remember there was a report that said that only a very few number of scholars that are in the Intergovernmental Panel on Climate Change are coming from the global south, right?
Yes.
And we need to change that if we want our climate reports to be truly inclusive of the global knowledge that we have. But also in terms of the climate negotiations, right? Who gets to attend? For example, the upcoming climate negotiations in Dubai in November, December. Are indigenous voices being heard in these policy debates, in these policy tables? And of course, ultimately, the decisions, the policies that are created, if there's limited representation from different parts of the world in the policy discussions, you can anticipate the policies to be also not inclusive and perhaps biased towards the interest of the North, of the West, of the powerful. So I hope I was able to kind of
absolutely. I
describe
think
the colonization.
we do not look at climate change in this way, and there is this whole issue of environmental justice. Maybe you and I can talk about that later, another time, because I think they tell me we are running out of time. But there is one question here, which is very important in ASEAN, which is transboundary problems. Whether it's the haze or other health issues. Um, are there initiatives you think within ASEAN right now that we could hold up as a good example or bad example? I know that our transboundary haze agreement is one of the failures of what we plan to do as a group. But what's your thought on that?
Sure. And it connects to my earlier comments on the need for more regional collaboration between governments, between universities, between civil society as well, and even the private sector. Because, a lot of, ASEAN companies are present in more than one country. And they can also play a critical role in, for example, pollution management across borders. I understand in the ASEAN Secretariat or in the ASEAN governance system, there are some initiatives that look into this. And again, it's the same issue as the health cooperation. We need to put more resources in order to expand these existing initiatives. It's applicable for the transboundary air pollution, but also, for example, issues surrounding our oceans, because we all share the same,
of course,
fisheries, for example, which are vital for our nutritional sustenance. Many of our citizens in the Philippine Islands or Indonesia or even some parts of Malaysia, they rely on what we get from the oceans for protein and other forms of nutrition, right, or nutrients. And again, universities, maybe even the national academies of sciences like ASM can actually come together and call on the governments, make unified statements, and create opportunities for more professor, researcher, student interaction within the region to address these shared challenges.
Yes. Although I dare say that when a haze occurs, the problem is not so much scientific as it is political, Renzo.
Yep.
Because no one country is going to take responsibility for all the fires, and there's a lot of finger pointing. But anyway, that's going to we have to discuss that another time. But since the time is running out, and getting some wisdom from you, maybe this question would be nice. That how can individuals and communities take meaningful action to promote environmental health and sustainability in their everyday lives, Renzo? Maybe you can part with that advice.
And I like this last question because we talk about policy, we talk about the role of research, we talk a lot about international collaboration, but change begins from within.
Okay.
At the level of individuals, households, and communities. And we can do so many things in order to alleviate these environmental health problems that are at the nexus of human and humanity and the planet. When it comes to plastic, for example, we really need to be better in terms of our plastic utilization. And I would say that it starts with rethinking our food packaging. Do we use plastic when we purchase, for example, from the store? I believe when I was in Indonesia, there are already stores that are charging extra.
Yeah, in Malaysia too.
If you ask for plastic, we need to do more of that in other countries and cities. When it comes to waste management, that's another thing. And the management of waste again begins from where it comes from, right? In the house, in the school, in the office. And unfortunately, for example, in the Philippines, we have very strong waste management policies, but the implementation is very, very weak because there's very little change that is happening at the level of the household. So that also needs to change. And energy use also, we briefly talk about air pollution, which is being contributed by fossil fuel burning as well. And our diesel-powered cars. So we need to also rethink the way we use energy in the house, energy efficiency, but also shifting to clean renewable energy sources. So those are just some of the things. Of course, food as well. There's so many things I can enumerate.
Renzo, you and I need to stop traveling on those aeroplanes to attend conferences, yes?
Yes, we need to minimize.
Absolutely. Renzo, it's been lovely talking to you. There's a whole slew of questions that I have not asked. And we know that this should not be the last time we'll be engaging you. As I said, when we write this report, from going from a report to actually implementing some of those ideas, we need lots of inputs and hardworking people like yourselves who will help us. Yeah, promise you'll do that for us, Renzo?
I'll be with you until the very end.
Very end, yes.
Because you mentioned we need to monitor also the implementation
and evaluate what it is that we scientists have proposed to the government. That would be the real end of our work. So, Renzo, thank you so much. And I'm sure we're going to have to come up with another podcast very specifically on some subject, if you don't mind.
Thank you so much. And again, congratulations to ASM for this initiative.
Thank you. Thank you so much. Bye.